thinking about kind of women's hormone health through different life stages, right? Because it starts with childhood, what they're eating, what, what is on them, whether it's like sunscreen products or all these different potential endocrine disruptors. So it starts day one, right? It starts before that. And then you have, the puberty years, and all throughout fertility. And then, of course, perimenopause, menopause, and post. So I know that's a big question, but maybe just, how you think about hormone health and some of the non-negotiables throughout these different life stages that we go through as women.
Wow, that's a big question. It's so funny because until the last 12 years, I didn't even ever think about it. I
Yeah.
never even heard of most of these hormones throughout my whole medical education.
That
But
and
now
that's
I'm pretty focused
crazy.
on them.
So in
It is
medical
crazy. It is
school, in
crazy.
medical
Like I
school,
had never heard the word estradiol, I don't think, or progesterone
that's
throughout
crazy.
all of my medical education. But I think that it's the foundational stuff is always foundational. So whether you're 5 years old or 10 years old or 30 or 40, making sure you're eating as healthy as you can, as clean as you can, you're getting exercise, you're sleeping well, like all of these things, keeping stress down, all of those things can make a big difference in hormonal health and the way that your body's making hormones. I'm not a pediatrician, so I don't know a lot about early years, but I will say that, once you start menstruating, it's very important to have normal menstrual cycles, like to have regular cycles. And so one thing that I would tell women, if your cycles are not regular, if they're very chaotic, if you're skipping months, things like that, that's a red flag that something is going on. Unless you're on birth control or something like that. And so one of my first tips is, if you don't have regular cycles, go see your doctor and try to understand what's happening, because it's something in your body is yelling and saying, hey, we need some help. And I think we've gotten really good as a society of just kind of ignoring that and maybe throwing birth control at you and going forward, but we need to do a better job at that.
What are some of the main symptoms? What are some of the things that you would say outside of just cycle regularity that are the absolute like telltales that you've got something going on?
I mean, I think that there are a lot of symptoms. I think this the biggest thing is, if you think something is wrong, like something doesn't feel right within your body, then that should be taken seriously, and you should continue. You should have a doctor who takes that seriously. So maybe
Yeah.
it's you're gaining weight for no reason. Maybe it's you're
Mhm.
really fatigued. Maybe you're not sleeping well. Maybe it's, it could be skin rashes. It could be 100 different things. But if something doesn't feel right to you, then you should be empowered enough to go to your doctor and say, something's not right, help me
Mhm.
out, and then have a partner there with your
Mhm.
doctor to kind of start going deeper, because it could be any of dozens or hundreds of things, but your doctor is there to hopefully help you figure it out.
A lot of lack of education, I think, is a fair way to say it around hormone health in general. Why do you think that is?
Yeah, in 2002, when the Women's Health Initiative came out, that was the big study,
Yeah.
that kind of scared women and their doctors about hormone replacement therapy. And so basically, since that time, 23 years, an entire generation of doctors who were educated during that time didn't learn about hormone replacement, because they thought it was dangerous, so they just didn't learn about it. And so you have all these doctors who are now, my age or maybe even younger, who just weren't ever taught. And it's a big, to understand how to replace these hormones properly does take quite a bit of education, but it has to all be self-driven. They have to go to courses, they have to, go to
Yeah.
conferences, they have to do these things, because it wasn't taught in school. So it's a big hurdle, I think, to get over. And unfortunately, less than 5% of women over the age of 50, who are candidates for hormones, are currently taking them, which is
Wow.
crazy.
Wow. Do you think that's because the Women's Health Initiative and that study and just kind of the lack of good information or misinformation, however you want to say it, but I'll just say the lack of good information out there?
Yeah, I think the WHI, that study, did a huge disservice to women. It's probably one of the biggest sort of medical blunders that has happened in the last 100 years. And it has left a whole generation, many, many women without proper medical care, and without, things that could have not only helped with quality of life. These hormones are helpful for symptoms, but even more importantly, these hormones are helpful for preventing chronic diseases like osteoporosis and heart disease and dementia, and things that kill women. And unfortunately, there are a bunch of women who just never had access to them, and doctors who don't know how to prescribe them.
This one was super interesting to me because this was the largest clinical study, right, known to man. I think it was 160,000 women. Is this right, Dr. Amy? And then it was
I don't remember the exact number, but yeah, many, like more than 100,000 women.
but it was $1 billion of taxpayer money, right? So, I mean, this
Yeah.
was a huge study, and maybe just shed some light into it in your opinion of what you think happened here.
So the study was, only about 2 years into the study. What happened was they were doing kind of preliminary data, looking at preliminary data, and they found that they thought that the women who were taking hormones had a increased risk of breast cancer, heart disease, strokes, blood clots. And interestingly enough, what they did was instead of going through their data and going kind of through the peer review process and publishing their data, they essentially went directly to the media and they called all the news stations and said these hormones are dangerous. And then essentially it became this like mass hysteria situation. Later, when they actually published the data and had the peer review process and everyone looked at it, we realized that it was only the synthetic progestin group. So the group that was getting this synthetic form of progesterone, it was only those women who had increased breast cancer. For instance, estrogen actually decreased breast cancer risk, and it was only essentially a small population of women who were having problems. This study also used kind of the wrong hormones. It used synthetic hormones, not bioidentical, and it also treated older women. So these women were 15 years out from menopause onset. So they were very, a lot older than most women in studies. So they did a lot of things wrong, but probably the biggest thing was just releasing their incomplete study results in such a way that caused mass hysteria. And unfortunately, once women are afraid and doctors are afraid, we know now, I mean, it's 23 years later, people are still afraid, even though this has been kind of debunked hundreds of times.